Welcome to the presentation of the 2016 Employee Benefit Program for Posados Cafe. Open enrollment will be held from December 14th through December 21st, 2015. Enrolling in and making changes to benefits. The elections you make during the open enrollment period will be effective January 1st of 2016 and will remain in effect until December 31st, 2016. These benefits will stay intact unless you have one of the qualified events listed below. Such events are marriage or divorce, birth or adoption, death of a dependent, change in your spouse's employment, your child aging out, reaching the age of 26, or a significant change in coverage or cost in your spouse or child's benefit plans. If one of these life events happens during the year, you need to contact your HR department within 30 days in order to make any changes. If you miss that time frame, your benefits will remain in place until December 31st, 2016. So what's changing in 2016? Posados will be offering two plans this year, the Minimum Essential Coverage Plan and the Minimum Value Plan. The MEC, or the Minimum Essential Coverage Plan, covers 100% of the government's listed preventative and wellness benefits as determined by the Affordable Care Act. It's designated to satisfy your obligation under the individual mandate of the new healthcare law and to allow you to avoid any tax penalties. The MVP plan includes the preventative and wellness benefits along with some additional hospitalization. More changes. The Minimum Value Plan carrier is changing from Key Benefits Administrator to Lucent through North American Administrators. The base Minimum Essential Coverage Plan is being offered to all employees at the employee-only level at no cost. To enroll in the Minimum Value Plan, you will need to submit an application and answer medical questions. The MVP final rates will not be determined until all medical underwriting has been completed. We will need a minimum of 10 employees to elect that plan, and all applications need to be submitted to HR by December 21st of 2015 in order to give the carrier time to underwrite and release final rates. The 2016 tax penalty is the greater of the calculated percent of your adjusted household income or the combined per person penalty for each person in your family. The individual mandate tax penalty will be $695 per adult, $347.50 per child, up to $2,085 per household, or 2.5% of yearly household income, whichever is greater. So how do you enroll in these plans? All benefit eligible employees must complete one of the two forms for either the MEC or the MVP. If you are waiving coverage, you must indicate why you're waiving on the declination form. All personal information will need to be included, such as Social Security numbers and dates of birth for all covered members. Please be sure to write legibly for the carriers to be able to understand and evaluate your information. Enrollment in the MVP plan requires questions to be answered on the medical history questionnaire page. That form must be submitted by 12/21 of 15 if you intend to elect the MVP plan. If you get to a point where you need help understanding the benefits or enrolling and filling out the forms, the Employee Response Center at Higginbotham, your broker, will be able to answer questions. The phone number is 1-866-419-3518. They're able to take your call Monday through Friday from 8 a.m. to 5 p.m. If you are forwarded to a voicemail, please leave a message, and the call center will call you that day or the next day. So you need to decide which plan is best. You need to determine which premium fits your household. Remember, preventative care is covered on both plans. You need to determine how often you see a doctor. Are you taking ongoing medication? And are you likely to have services that would be applied to a deductible? And do you need the flexibility to go out of network? The benefits for the MEC and MVP plan are illustrated on this page. The base MEC plan utilizes the First Health Network to cover preventative care services. It covers the 63 services as determined by the Affordable Care Act. In addition to those preventative care services, you'll have access to telemedicine services discussed further into the presentation. The MVP plan accesses benefits through the Cigna network, along with covering the preventative care services. You have access to additional benefits. The deductible for those benefits is $4,500 for an individual and $9,000 for a family. The out-of-pocket maximum on this plan is $6,600 with $13,200 for a family, and the coinsurance on the plan is 80%. As you access benefits, you will be responsible for the cost to the provider as determined by the contract with Cigna Healthcare. Once you pay those costs, they will accumulate toward the deductible. And once you hit that deductible, the insurance company will begin to pay 80% of those costs, and 20% will be responsible for you. The cap on that 20% is $6,600. This would go for all medical benefits along with your prescription drug benefits. In addition, you also have access to the telemedicine benefit that will be described in a future slide. So how much do the plans cost? As you can see, the base MEC plan is offered to all eligible employees at no cost, and the cost for their employee plus spouse, employee children, and employee family is listed in the column under the base MEC plan. The MVP plan is offered at $90.10 for the employee only tier, and then the employee spouse, employee children, and employee family rates are listed as well. Please remember, these rates could change depending on how the health questionnaires are rated once all applications are submitted to the carrier. Your Healthiest You benefits are available for both plans. You'll have access to physicians 24/7 by calling the phone number at the bottom of this page, 866-703-1259, and they'll be available 24/7 to diagnose, treat, and prescribe. Consultations are provided at no additional cost to you, and you also have additional savings at the pharmacies based on this Healthiest You benefit. You'll have applications for your smartphone to be able to cost compare, track your deductible, verify your wellness, and find top providers. Your customer service contacts are illustrated on this page. You have the claims and customer service through North American Administrators. If you elect the MEC plan, the First Health Network contact information is listed. If you elect the MVP plan, the Cigna network is utilized for the medical benefits. And then for the prescriptions on the MVP plan, the customer service number for Magellan RX is listed. For your telemedicine information, Healthiest You has a phone number and website listed as well. We appreciate your participation in this presentation. Remember, if you have any questions on how to enroll, please call the Employee Response Center at 1-866-419-3518. And they're available Monday through Friday, 8 to 5. You also have access to an email address, the helpline at higginbotham.net. Once again, we thank you for listening to our presentation and look forward to working with you this year. Thank you.